This is going to be the patient eligibility, any way you want it, webinar. And so if at some point you would like to review the webinar later on, you can certainly feel free to do that. And so as we begin, I'd like to take a couple of polls here. First poll is, how are you currently doing your patient eligibility? The question here is specifically for Medicare. So how are you currently doing your patient eligibility? The answers are in Team DME Excel. Of course, that was a feature we added, I believe, back last year, about January, by telephone or by website. Specifically, again, we're talking about Medicare patient eligibility. So answer the question there. We're going to give people just another minute to get started here, or to answer the poll, and then we'll share that with everybody. Most people, got a lot of information to cover today, so I'm going to be moving fairly quickly. So I'm going to ask you to, very quickly, get your question asked, and we'll go from there. Okay, I'm going to close the poll, share that with everybody. So a lot of people are doing their patient eligibility in Team DME, about 40%. About 20% by telephone, and then 35% by a website of one kind or another, and 7% don't check patient eligibility. So to those people, I would say that's something that we probably need to change, because patient eligibility is one of the easiest things that that you can do, and making sure you get paid is, of course, a huge concern in kind of the the industry as it is today. All right, I'm going to go ahead and get started with the webinar. Share my screen here, and it appears to be. Hold on just a second. Let me just double check that it is. Nope. Hide the poll. Okay, Mike, help me out here. It shows that the is the web session being displayed? That's my question. Oh, here we go. All right, show my screen. All right, it wasn't showing up because I guess I had the poll still being presented. So hopefully everybody can see me at this point. I'm going to hide some of those windows here. We're going to take a look at them here in just a minute. First thing I'd like to do is just show you patient eligibility as it sits currently. We're going to take a look at a particular patient, Christina, and basically here we are on the customer edit card. In order to do a patient eligibility, now again we have the ability to do patient eligibility for Medicare as well as other payers. And so the menu has changed just a little bit. It used to say check Medicare eligibility. Now it simply says check eligibility. Okay, and basically the idea there is you can check not only Medicare but other payers as well. The way to select the various payers is basically highlight the policy card, and then when you check eligibility, you will be checking for whatever payer you have highlighted. For example, I've got Medicare highlighted, and so when I click check patient eligibility, the first question it's going to ask is select the date of inquiry. Okay, you can use today's date. There really would not be a benefit of trying to check eligibility, I think, into the future, because this is going to go out to Medicare system or Medicaid or Blue Cross Blue Shield, and they're not really going to have information, at least very far into the future. But if you wanted to check eligibility for today, but not necessarily, maybe you wanted to check it for last month or the month before when your date of service was, you would want to put the date in there. If you're instead in an order, for example, here we are in an order. I'm going to go clear my filter here and go to the bottom, pull up Christina's order. If instead you're checking eligibility there, it's automatically going to check the primary payer of the order or recur or claim that you're on. Okay, so you don't have to select a payer in that case. It's automatically going to check the primary payer. But in either case, it's going to, if we're doing, in this example, Medicare, it's going to go out to Medicare's site and bring back the data for us. Now, I'm not going to do this actually because, of course, HIPAA and the privacy laws, but I'm going to show you some of the examples of some eligibility checks that have come back from various patients. You'll also notice I'm showing you a new feature here. Previously, we had the patient eligibilities appear in the comments tab. With the new update, those 271 records have been moved into the policy tab under the notes down here at the bottom. And so basically we're collecting all of your patient eligibility checks in one place, and because again we're doing eligibility checks not only for Medicare but also for other payers, you can separate those as well. For example, when I'm on Medicare and clicking on the notes, I'm seeing only my Medicare patient eligibility checks. Okay, I'm going to jump up to the top here and just give you an example of what might come back. In this example, when we did this check, this particular patient had Medicare Part D, had hospital and SNF information, had home health information, and that was it. Okay. As we look at other patient eligibility records, you'll notice that these tabs sometimes change. Okay. And the idea there is basically if there's no information to present on a tab, I want to take that tab away so that you're not even, considering it or having to step through it and say, oh, it's empty. And so basically if you see a tab here, that means there's information to present. For example, hospital and SNF, there was information showing 90 days, lifetime remaining in the hospital, which we're not interested in. But the date of last billing activity would be something that we would be interested in, as well as the date of earliest billing and latest billing activity for the skilled nursing facility. So, basically that comes back automatically, to us and is presented in this nice tabbed format. Makes it really easy to see the information. We've modeled this against, Medicare's own program, so hopefully this will be familiar to a lot of people. The other thing, just to let you know, is that basically if what you see presented here, you feel like that there's something perhaps missing or being reported incorrectly, then you can always go to the Report tab, and basically what the Report tab is everything that came back in that patient eligibility. A lot of this information is not HME specific, and so our thought is we're not even going to present this to our customers, most of whom are going to be strictly HME providers. And so we're pulling out the HME specific information that we think would be beneficial to our customers. And the other information we've hidden. Well, not hidden, we've just not presented it. But basically if you want to see it, you are welcome to do that because this has everything. For example, if we go down through here, we have information on dental care. We have information on vision. We have information on smoking cessation. I don't see that right offhand, but there's urgent care information, etc. There is a lot of information being presented in the report section, but the HME information of import we're going to present to you in the tabs as well. So those are a couple different ways that you can get that patient information. Okay. All right. I'm going to go ahead and take a look at another couple of examples here. This one is a hospital and SNF example that shows you the how the information of earliest billing activity and the latest billing activity will be presented if the patient were in the hospital. If the patient were in a skilled nursing facility, how that information will be presented. Okay. And I'll give you an example of a customer coming back with a date of death. Of course, that's right up at the top. That's very important to us. We want to immediately start scheduling equipment to be picked up, contacting the patient survivors to make some, I guess, some plans for the return of our equipment or other things. And okay, hospice information. We don't think we've seen that tab pop up yet, but basically here is both the Medicare Secondary Payer tab. I think it's the first time we've seen that, as well as the hospice tab. And so there's the information being returned from Medicare on hospice. And finally then, HMO and the remaining deductible. Here we are at the first of the year, and so the remaining deductible is really important. Medicare has a deductible, I believe I looked that up, of $149 per year. And so, a lot of my customers are concerned that that they're going to get hit with that deductible. And so, with a couple of clicks, you can see what the patient's current deductible is as per what Medicare's system shows. Now that may not be may change by the time you send a claim in, but hopefully that would be going down rather than up. So there's the HMO tab, and you can see the HMO information. Again, this is the time of year when patients will have been recently switched from a regular Medicare plan perhaps to an HMO, and that's something that we need to be very careful about, because a lot of times the products that you're going to be providing are not going to be paid automatically by the HMO unless you contact them and get signed up, or at least get that patient signed up for you servicing that patient. So for lack of a phone call, you may not get paid for 2 or 3 months until you figure out that that patient is in an HMO. So all right, that kind of gives us several examples of how the patient eligibility will be presented to you once it comes back from Medicare. Let's take a look at how we set up a payer for getting the eligibility check. And what I'm talking about here is for each of your payers. For example, there's AdminStar. You have to set that payer up in order to get your patient eligibility done. And the way to do that, I'm going to click on the ellipse button, click on the edit button, and there's my AdminStar Federal. And then I'm going to go to the billing tab. Okay, that's where all of your electronic information is being presented for both claims, payers, clearinghouse, and what we're interested in today is the bottom one, the patient eligibility. Okay, you have 3 questions down there. I can't highlight them. I'll highlight the answer, but the submitter ID. The submitter ID is going to be what electronic identification number, submitter number, that you're going to use when you communicate with this particular payer. Okay, and basically you have 2 choices there. If you are already signed up with this payer and they know who you are and you have a patient eligibility account, okay, that's very important, because you may have you may be signed up with the payer as a provider, but you may not be signed up with the payer to let them know that you're going to be getting or asking for patient eligibility information. And so if you are already signed up with the payer, which this would be an example of that, just put in your patient eligibility submitter ID. Okay, and again, that is not your electronic submitter ID, but your patient eligibility submitter ID. And we will submit that on your behalf when we talk with that particular payer. Now really what I'm talking about here is Medicare, okay, because when you go to Medicaid or commercial payers, the rules change. Everything is going through our account in that example. And then you'll want the receiver ID. Okay, if you're dealing with Medicare, which is our example here, you need to use one of the Medicare numbers. For example, AdminStar, I don't know right offhand which region they're in, but I think they're in region B. So that really should be 17003, which is going to be DMERC region B. Okay, and so in this example, I'm using my electronic submitter number that I have set up with AdminStar to be able to communicate with them. Now, if you're using Team DME's account, in other words, if we're sending the patient eligibility for you, then instead of using your number, this needs to be Team DME. Okay, so you are sending through Team DME, okay, not the program, but through our patient eligibility submitter ID, and the receiver is 17003, which is going to be, in this example, Region B. And that's how an example of how you would set up a Medicare payer. Okay. And that's how you do it. Okay. Now, I'll talk just a little bit about, and that's kind of what we have all been providing for, over a year now. What does that cost? Well, that's basically free if you're currently sending through our CDI gateway, or if you're not sending through our CDI gateway, it costs you $25 a month to sign up for that program, and then basically you can click as many times you like. There is a cost to it, on our side, but basically we're providing that to you as a free service. Why are we doing that? Because we feel like it's extremely important that you check your patient eligibility, make sure that the patient is legitimate and you've got your numbers correct and all of your billing information is correct. We've been working very, very hard on reducing your electronic submission errors, and so this is kind of one part of that, is making sure that you have the correct information. And I'll show you some examples of some of the problems that that we've seen when people are doing patient eligibility and the problems that are being caught through the system. But I'll take just a minute here to answer some questions and take a look at that. Mike, do you have any? Okay. Let's see. Is it filling out the tab automatically, or does it bring up the info?
Yes, Rick.
Okay.
The major questions were, when is this going to be available for people?
Good question. This information that I've shown you to this point has been available for over a year. So it's available right now. I'll show you in just a minute how you can sign up for it, and you can start doing this is called real-time, one-click patient eligibility, and so you can start doing your real-time patient eligibility checks right away. Okay? All right? Hold on just a second. I'm just reading through a couple of other of the... Okay. Is this eligibility subject to Noridian Endeavor system issues, or is it coming from another source? Basically, the information is coming directly from CEDI. I don't know anything about the Noridian Endeavor system, so I can't answer that question directly. But basically, when you send the request in, we are basically turning around and immediately sending that same information directly to CEDI, okay? Getting the response and then returning it to you. So basically, you're not connected directly. It's kind of a hopscotch, but basically the request comes from you to us through Ivans to CEDI, and then back through the process directly to you. So in a second or two, you have your answer, but that's coming directly from Medicare, okay? If there are any issues with the Noridian Endeavor system, I can't answer that question, but I can tell you you're getting the most current information from CMS, okay? Somebody, for example, on the deductible may submit a claim today that updates the deductible tomorrow, but as of this moment, this is the most current information, okay? And so what are some of the reasons that that we're going to find? Well, one is my customers tell me that basically if you bill a recurring order past the patient's date of death, obviously that is inefficient because clearly you're not going to be paid for that. But beyond that, Medicare considers that fraud. In other words, you should have called the patient prior to billing that service. Therefore, they consider it fraud. And certainly we want to stay away from that moniker, and so checking eligibility even on every recurring order that we send would be a great idea. Secondly, patient went into an HMO program. As I mentioned, if we don't get signed up with that HMO program, even though we're providing the service, my customers tell me that basically the HMOs will not retroactively put you in. You've just basically lost the month or 2 months of service that you provided the customer thinking they were in Medicare when really they were in a Medicare HMO. So it saves you money. providing services prior to the patient's effective date. Their insurance doesn't start until May 1st, and yet you provide equipment in the middle of February, you've just lost that money. And there are other reasons why you would want to do your patient eligibility there as well. But that's basically how it works. It's as simple as a couple of clicks. The other thing I don't think I mentioned, but instead of asking you if you do this from an order, I guess I can just do one here. But if you do check eligibility, from an order, you can choose a different date. For example, it's coming up with today's date automatically. Normally, you'd probably want to check eligibility in the case of an order for the date of service. That automatically happens when we get to the batch process, which we'll be talking about in just a few minutes. Okay. All right. I'm going to minimize a couple of windows here, and let's start talking about the batch process. Okay. Basically, what the idea here is, patient eligibility is great, but I've got a lot of orders, I've got a lot of recurring orders, I've got claims that I would like to check eligibility on as well. Oh, I forgot, I do have a poll here that I wanted to ask. First of all, we'll launch that. How are you currently verifying insurance coverage? And I think this says with Medicare, if I'm not mistaken. So how are you currently verifying your insurance coverage? Give you just a minute there to answer the question. Okay, and we've got 90% of the people voting. I'm going to go ahead and close the poll. Like I said, we've got a lot of information to share today, and I'm going to share that with you. 3% are, let's see. I have to make that just a little bigger so that I can even see the question. What's happening, the question is actually, how do you verify insurance coverage for Medicaid and commercial? So actually, I'm jumping ahead just a little bit, but I will show you that poll anyway. I should have gotten that after my after I talk about the batch, but 3% are doing it in Team DME. Okay, that's a little bit of a trick question. You can't do batch in Team DME unless you're one of our customers in the beta program. So maybe we have some beta customers on the webinar here. 9% are doing it by phone, and 90%, about 88%, are doing it via a website. So that's great. But we'll come back to that in just a minute. What I want to talk about was the batch. Basically, if you have medical orders, or you have recurring orders, or even claims, then you can do this Medicare eligibility in a batch mode. Okay. Now, the way that works is you basically identify which orders that you want to do a eligibility check for. Now, I could attempt to do it right here, but I don't have all of my payers set up, and so it's basically going to come up with this little informational, hey, you've got a payer called Tennessee Medicaid, which is not set up for patient eligibility. And so, okay, what do you want me to do with it?
Excuse me, Ray.
Yeah.
If you could show your screen.
Oh, sorry. Let's see. I need to hide the poll. That's how that works. All right. That's now good. You should be seeing it. But basically, I can go to Edit and Print Report and Batch Eligibility and Request, and basically it says that, hey, you got a payer, Tennessee Medicaid, which is not set up for patient eligibility. Okay. The information is you either need to set up Tennessee Medicaid, or you have inadvertently left that claim in your filter and you didn't want to, and that's what I have done in this case. I have a couple of queries set up. I'll just show them to you there. That's basically, I've got one called Medicare Claims. I'm going to do a batch eligibility for Medicare claims, and what the filter is basically my payer is the primary payer, list order is equal to number 1, and the carrier of the payer is equal to C, which if you remember that's going to be all your Medicare carriers, region A, B, C, and D. And so here are a list from my medical order section of all of my orders where Medicare is primary. Okay. Now you'll notice specifically Christina Long is sitting right there. She's one of my patients. Okay. And so I'm going to do edit, and I'm going to print report, and I'm going to batch and request, and then there it goes. Okay. Now it says basically let me rephrase that. I'm going to have 11 Palmetto checks, 15 Cigna checks, and 38 Administar checks for a total of 64 checks. Okay, so it will tell you right away what it's going to do. The other thing that you'll notice, if you have your Medicaids, if you have your Blue Cross Blue Shields and other commercial payers set up, you can do those in batch as well. Okay, this is not limited to just Medicare, but you can do other payers as well. It will show it to you right there, in the list, and you can choose to do that or not. Now, I'm not going to click OK here because I don't want it to send this particular request off for me. But what happens when it does that? Okay, first of all, it will update the customer to show me that there is a patient eligibility request out here outstanding for that. I'll go to the policy and the detail. There's my Administar. Go to notes, and here's what we see here down at the bottom. Okay, now in this example, I have two orders or two orders that I'm checking eligibility for. Okay, now that's important because it's the same patient, but I may have an order with a date of service that was 30 days ago, and so I want to check eligibility 30 days ago, and I've got another order that's supposed to be going out tomorrow, and so I want to check eligibility for that date of service. And so there will actually be two checks in that example. But you can see here from the note that the eligibility request has been sent. Okay. Now batch, normally when you click on the patient eligibility, that information is returned to you immediately. Okay. Generally in 1 to 2 seconds. When you do a batch, we do those overnight. Okay. So you'll send off the request today, you'll have the results available to you tomorrow. And so this is an example of one that has been sent off, but we've not received the results back yet. Okay. Here is one that has been sent off, and then by the second description, you can see that the response has been received, and the date and timestamp that you can see associated with that. It looks exactly like any other patient eligibility. There is no difference, okay, because actually what happens in this example is when we get the request for the 100 patients that you'd like to check, we actually send them to Medicare one at a time, just like you would be normally clicking and getting that information. So when they come back, it is exactly the same information that you're going to see through the real-time or the one-click process. Okay. So basically that that happens automatically, and again that's the way it works. You create the request, that gets sent to us. We will process those in the middle of the night, and then have the results or the response file ready for you the next morning. Okay. Okay. Let me make sure I've got all of my. All right. Now, that's great, but I really don't want to have to wade through hundreds, and for some of my customers, thousands of eligibility checks, looking at each one individually to kind of find the outliers, the problems that we're dealing with. Got somebody who says we can't see the screen. Let's see. Okay, that was from before. Thank you, Mike. So we don't want to have to wade through hundreds of eligibility checks. Okay, well, what we do there, let me just pop up the task list. As we get that information back, we will automatically create a task for you if we see a problem. Okay. Now, what might be presented as a problem? Well, if you'll kind of look at the help system on the batch, it will identify some of those issues, but it would be things like the address doesn't match. The patient's gender doesn't match from your system to Medicare system. The patient was in a hospital. The date you're checking was when the patient was in an HMO. The date that you're checking is when the patient was in a skilled nursing facility. This is what that would look like. Okay, you can see here the date is going to be the date that you ran it. Okay, which will be yesterday. The person's username is going to be Christina Long because she is the person who requested the information. If you'll notice here, I'm probably logged in as Christina again. And so that is the person that task is assigned to. Okay, I can look at it and I can see here, okay, this information is asking me to review the HMO. My date of service was 11/15, and the HMO effective dates, or not effective, but first and last billing service, I forget exactly how that looked, is from 11/1 to 11/30. And so my date of service that I'm trying to provide a claim is within those time periods. Now, maybe that's correct, maybe it's not, but this task is simply you need to look at this and make a decision, okay? And so this is an example where the date of service fell within the home health, okay, effective dates. Okay, this one is an example of where the date of service fell within hospice. Okay, take a look at this one. Dates of service fell within the SNF, skilled nursing facility. All right, this one was a gender, and we actually have had some of these come back from the customers doing beta testing for us. You know, they thought the customer in this example was female, but Medicare thinks that the customer is male. So that probably needs to be changed at some point. Otherwise, we're going to, have problems later on. Here's one where Part D was inactive during the period where we're trying to use our data service. Okay. And here's another Part B. Let me see if I've got, here's a date of death. Okay, we don't have a date of death on file, but Medicare does, and so that's something that we probably need to look into very quickly. And here's an address difference. Now, excuse me, what we're finding is that the address differences are just all over the place, because generally when you put in the address, even if you type out the word road and Medicare has RD or vice versa, those are not matching. And so that's a fairly minor error, perhaps insignificant, but we want you to look at it as well. So you might look at that and go, I don't care that Medicare says Apartment 1B, and so I'm just going to delete that task. That is entirely up to you. What you do with the task is, of course, up to you, but we want to basically provide that information for you. Now, what happens with it, let me see if I can find one just as an example here. That date of death would be interesting. If I can remember, there we go, where that was. From the task list, of course, I would hope that you can press Control-T and it will actually bring up for you the order or the recur or the claim where that particular edit check was generated from. Okay. Now, when we see a problem like that, we're automatically, and again, this is my test system, but we're automatically going to put in a hold reason, something to the tune of review, date of death, and something like that. I'd have to go back and pull the exact terminology out of the system, but basically, it's going to put a hold on that order or recur or claim automatically for you. Okay, and so the best thing that you can do is say, no, it's a mistake in Medicare, or in this example, let's say date of death. We should not be billing this. We need to turn this into a pickup order. Okay, so we're going to take out the hold reason, and then we're going to go into that order and make it a pickup instead. Okay. So basically, that would be my order of processing. As I'm looking at the task, I would look at, for example, the address different. I'd either update my address or I'd say I don't care and delete the task. But on the address, I don't think we do a hold reason for that. But the things like date of death, HMO, the hospice, we will do a hold reason within the order recur claim so that you can decide what to do with it. Okay? All right. Now, what should happen next in the batch processing? Well, we have fixed what we're interested in. We have, reviewed those. The next thing I want to do is actually process them. Okay, how might you do that? First of all, if there are any problems, of course, we have addressed the individual problems. But some of my customers are using this to say, hey, at the beginning of the year, I don't want to be hit by, for example, the deductibles. And so I'm going to hold my claims a little while, and I'm going to let somebody else get hit by deductibles. And so the way that we can now do that is basically we can develop a filter. I'll show you how that works. Called, this is just what I named it, Medicare claims where the deductible is less than $25. And basically, again, it's a Medicare claim, okay, because that's what I did the batch eligibility on. But then I've also said where the customer.deductible is less than 25. Okay, if it is exactly 25, I'll wait a little longer. But if it's less than 25, I want to go ahead and put my claim in because I can afford to get hit with a $25 deductible, but I can't afford to get hit with a $150 deductible. My customer who's really been using this, their average claim is about $150. Well, guess what? Medicare's deductible is $149. So if they're the first person to get hit, they satisfy the deductible and then can't get their money from the patient. But basically what happens there, we can click OK. Now you'll notice that Christina Long is no longer in our list of claims. That's because her deductible has not been met yet, and so she's no longer on the list. The idea here is now I can go in and I can release some of these orders and provide them knowing that I'm probably going to get paid at that point. Okay? Well, how do you set up a payer for batch eligibility? Okay, we've already seen how to set up a payer for the real-time eligibility for Medicare, and the answer is it's exactly the same. Okay, if you've got a payer set up, a Medicare payer set up to do the one-click patient eligibility, that's exactly the same process that you would use to do batch eligibility. So you've already got it set up. Just to give you an example, we've got one of our customers in the beta program who's sending, about once a week, I think, batches of 2,400 eligibility checks. Okay, and I kind of did a little math. If they had an employee who did nothing but, click the button and get an eligibility check once a minute, 8 hours a day, no breaks, no lunch, it would take them 5 days, to accomplish that. Whereas she can basically request it, get the information back the next day. So, much more efficient use of someone's time. Give you another example too. One of the first batches we sent for that customer consisted of about 864 patient eligibility checks. There is a cost to that, so that basically would have cost them $86, but it identified 25 claims which would not have been paid. With an average claim value of $150, that was $3,750 just in that example. So pretty powerful stuff. So what is the cost? Okay, basically as you sign up, it will talk to you about that. But let me see if I can get that up for you. Let's see, that's on page 2. Basically, the cost is basically the Medicare Real-Time, as I mentioned. That's going to continue to be free as long as you're using the TeamDME gateway. The Medicare Batch, basically there's a cost of that of $20 per 200 checks. So if you do 200 checks in a month, it costs you $20. And I think that's pretty effective as we move forward. All right. Any questions about Medicare and doing batches of claims? Heidi asks, are the eligibilities printable? Basically, to answer your question, yes. Although that we don't print them out in batch, basically if you have, for example, let me get my customer back up here. You are looking at your patient eligibility. Okay, you can't print it out from here, but go to the report, and basically it's let's see, I don't provide a print, but basically you could cut and paste that whole area of information and print it out in a notepad, for example. That's something I hadn't thought about, so you might want to send that in on a wish list if that's something that is important to you. Will you be able to auto-run rentals every day? Amber asks. Don't have the ability to do an automatic. Basically, if you wanted to run rentals every day, you go into the rental section, edit, print, batch, request, and then, if I had it filtered down to just the list, click OK, your batch is sent off. So I don't, it's not automatic, but it's not difficult either. Okay. Will we be able to run batch out of customers and the reoccurs area? Again, you cannot run the batches out of the customers, but you can out of orders, recurs, or claims, either one. All right, let's move along then and talk about Medicaid real-time patient eligibility. Basically, the way that works is very similarly to the way that patient eligibility works for Medicare, in that, okay, you just simply click on the check eligibility and it will go out and do that. Now, you'll notice that I have selected AdminStar, so it's going to do a Medicare check if I click check eligibility here. What I want to do for a Medicaid is I want to go to Tennessee Medicaid. Okay, first of all, I want to make sure that that payer has been set up. Okay, and I'm going to click on the ellipse button, edit button. Again, just like we did for Medicare, I'm going to go to billing, but instead of using the drop-down list, okay, because this is specifically for Medicare, I'm going to have to look up their number. Okay, and the way to do that is this. Okay, if you will, first of all, in the email that we sent to you, I believe, let me double check that, we provided this full list of payers, and I am 99% sure of that. It said click here for the full list of payers. Well, this is the list of payers. Okay, for example, I'm looking for Tennessee Medicare or Medicaid, so I'm going to type in Tennessee or some part of that. There's Blue Cross Blue Shield, there's Medicaid of Tennessee. Okay, that will be my TennCare program. Call it TennCare here in Tennessee. You need the Ivans payer ID, okay, because basically what you're doing there, all of this information is being sent through Ivans to the various payers that we're dealing with. And so we need to tell Ivans, okay, I'm calling it Medicaid Tennessee, well, I might call it TennCare, but they will use that payer ID to identify who it really is. And so I'm going to get Medicare Tennessee, copy that, and I'm going to put that in the receiver ID. Now, for your Medicaids, every submitter ID, every submitter number is Team DME. Okay, you can't have gotten set up yourself with the payer. Well, let me rephrase that. Basically, the way we're sending it, that's really our only choice. Okay, so Team DME for Medicaid, and then the receiver ID you'll have to look up. Now, the URL down here at the bottom, that is if you have like a website that you might check eligibility for. We're not using that anywhere in the electronic system, but if you would like to put that in for other payers that you want to check manually, you're welcome to do that. But basically, that's exactly how you would set up a Medicaid patient eligibility. Okay, once I do that, click OK. Now I've got Tennessee Medicaid highlighted. Click check eligibility. It will ask me the same question, select date of eligibility, and it will then go out and process that eligibility. Now, I'm not going to do it right now. Now, this does take a few more than a couple of seconds. This takes generally, I think, about 10 seconds, if I'm not mistaken. So a few more seconds, but still, very fast. Look in the notes section, and you'll see a 271 record. 271, by the way, it means patient eligibility. That's kind of the number Medicare is assigned to it. Click on the scan. You'll notice that we don't have tabs across the top here. And the reason we don't is because, unfortunately, even though it's supposed to be a standard format, every payer is giving it back to us in a little bit different format. This is kind of our version 1 of Medicaid patient eligibility, and so perhaps in a later version we can add tabs, but right now we don't. It's basically all in the report. You can see here that this was processed by Medicaid EDS. Okay, now this was, I actually pulled this from Kentucky Medicaid system, but basically you can use this to confirm that you're getting it from the correct information. Your patient's name, identification number, and then you can see the effective dates down here at the bottom. The tricky part is what we found is that some payers are using this message text to convey information to you. Things like their type of coverage, things like their deductible, and so the message text is just a free-form area. There's no way really to put that into a tab. So anyway, there you go. Okay, here is another example in the message. The patient has a copay. Even though it's Medicaid, the patient has a copay. And that message isn't in anything that we could identify. It's just kind of a free-form message field. Okay. Now, you'll also notice that we're only seeing the 271s or eligibilities for the payer that we've got selected. Since we've got Tennessee Medicaid selected, we're only seeing Tennessee Medicaid's eligibility. If you go up to AdminStar, click on Notes, then you've got the whole list of patient eligibilities there as well. So just an FYI for you. Then let's also talk about commercial. Or let me take a look at my schedule here. Make sure I am covering everything. All right, we've reviewed the results. Okay, now let's talk about commercial. Okay, how can we set up for commercial? What is commercial? Commercial might be Blue Cross Blue Shield, Aetna, Mutual, Omaha. Any payer that's not really Medicare and Medicaid probably falls into that and other category that we'll call commercial. Okay, so basically the way to look at that is, for example, I've got a Blue Cross Blue Shield of Kentucky. First of all, I want to see that that patient is, or that insurance company is set up for processing. Okay, click on Edit and go to the Billing tab. The submitter ID again is going to be Team DME. Okay, everything that you're sending through is going to be Team DME. Receiver ID. Okay, you need to go back to the payer list that I mentioned to you previously, and in this case I'm going to type in Kentucky or some part of it, United Healthcare, and there's Blue Cross Blue Shield of Kentucky. That is the number that I want to use as a receiver ID for Blue Cross Blue Shield of Kentucky. So I'm just going to copy that number, okay, into here. Okay, and boom, I've got the I've got them set up. Click OK. Now when I want to do a patient eligibility for Blue Cross Blue Shield of Kentucky, I just have that particular payer highlighted, check eligibility. It'll go out and it'll provide the Blue Cross Blue Shield of Kentucky eligibility information. Okay, I'm going to just, this is an example of a Blue Cross Blue Shield. Again, Anthem is the organization here that processed it. Blue Card eligibility was the information source name. Okay, Jane Doe in this example, we basically sanitized. This is an actual eligibility check from Blue Cross Blue Shield that we've sanitized so that it's not patients' health information. But basically, you kind of look through there. Again, we're seeing that a lot of the information that you need is coming back in this message text format. Pre-existing is waived in the example for this patient. Let me see if we have any other pertinent information, and I don't see anything right offhand. All right, let's see. So now we've looked at Medicare Real-Time, the one-click, Medicare in Batch. We have looked at also Medicaid patient eligibility, and now commercial patient eligibility. Okay, we've looked at how to set those things up. Okay, what does that cost? Okay, again, going back to our sign-up spreadsheet here. Oh, I need to tell you about that too. But basically, for Medicaid and the commercials, it's a little bit more expensive. It's $20 for 100 checks. Okay, and again, that's we're passing through the costs that that Ivans is giving us for doing this stuff. There is one other cost to a patient eligibility for either Medicaid or Blue Cross Blue Shield, and those are called pass-through fees. Okay, you'll notice this. I think let's see. If you go to our website, teamdme.com/help, okay, this is our new help system that we are not ready to officially release, but it's probably 99% there. But basically, this is the page that you'll see, and at the bottom in the middle, we even have patient eligibility highlighted or featured currently, because that's what our webinar is about. That's probably what you're going to have more questions about. And so if you just click on that, it's going to give you the instructions on how to set up a payer to check eligibility. But it also has the list of all the payers, which I've been showing you, where you can get the payer IDs. And it also has this, let's see, for a list of Medicaid, let's see, I don't have the payer list. Hold on a second. Where do I have that? Here is our update information. If you're interested in the, I'll kind of jump ahead, but I'm going to show you how to get the latest update. That's here on the left, latest updates. You just click there, and it will tell you all about the latest update. Well, one of which is the patient eligibility for commercial payers. Okay, I don't see it right offhand there, but as you're signing up, there it is. Medicaid, and that really should say be Medicaid or commercial pass-through fees. Okay, basically that's all the fees that are going to be charged by the payer themselves. Okay, and that's what these are. For example, I'm going to look up TennCare. Okay, and I'm going to see Medicaid or TennCare has a pass-through fee of 4 cents per check. Okay, so when I check a Tennessee Medicare patient, it's going to cost me, the fee from TeamDME, but it's also going to cost me 4 cents. Okay, and unfortunately, there's nothing that we can do about that. That is a fee assessed by these individual payers. Not all payers have a fee. For example, I think Kentucky was the other one that I wanted to look at, and for Kentucky has no fees for both Medicaid as well as Blue Cross Blue Shield. And so, there still is the fee from TeamDME, but there's no additional fee that you would need to pay as well. All right, we are moving right along. I'm getting close to time. I like to keep it to an hour so that people are comfortable with attending these webinars. So I've discussed the the cost of it. The next question: how do I sign up? Okay. In the email that we sent you, I don't have a copy right offhand, but there is a link to how to sign up. It's also on the how to check patient eligibility. Click here to sign up for patient eligibility, and that's basically going to take you to our website here. Okay, and it will explain to you the services. You click continue, and you'll see, okay, here's how you can find the submitter IDs. Here's the Medicaid and commercial pass-through fees. Here is the fee schedule for both Medicare Real-Time, it's free, Medicare Batch, $20 for 200 checks, Medicaid and commercial in Real-Time or Batch. It doesn't matter whether you're doing one click or you're doing them in Batch, still $20 for 100 checks or per 100 checks. And then the next question is simply, do you want to use our submitter number or your submitter number to send patient eligibility requests to Medicare only. When you're sending again to Medicaid, commercial, you always are going to use Team DME. But if you're sending to Medicare, you can use your number if you are signed up, or you can use our number. Okay, there's no cost to it, no difference in the cost. So most people will simply use our number. Okay, and I mentioned to you that I was going to offer you something free. Here it is. For the next couple of days on the sign-up process, would you like to try it for free? And I'll give you 1 credit of $20 for both the batch processing and for the Medicaid and the commercial processing. So you can, try the batch. Okay, don't go over 200 checks if you want it to be free, but try the batch processing, and having clicked yes, you are the greatest, it will be free. If you click no, my company doesn't need it for bonuses or free lunches or anything like that, then it won't be free. But the same thing for the Medicaid and the commercial as well. Whether you're doing 1-click or you're doing batch, either one, your first 100 checks in that example will be free to you. So if you'd like to try it, this is only going to be available today and tomorrow. So you do need to get signed up, today and tomorrow. If you use it, let's say February or March, either one, we'll give you the first $20 worth for free, as long as you sign up today and tomorrow. All right, we are right on time here. I'm going to I do need to cover one other thing, and that's in order to use some of these features. Now, we talked about the Patient Eligibility Real-Time. That's been available for over a year. But if you want to use any of the other features, then you need the update. Okay? To get the update, you need to type in teamdme.com/help. Okay? And that will get you to our new help system, okay, which is the screen that you're seeing now. Then you want to go to the latest update and click on that, and it will explain to you the latest update and then give you step-by-step instructions on how to do it. Basically, the step-by-step is you need to make a backup. Okay? You need to step number 2 is you need to, from the server, first of all, get everybody off. But from the server, start the Internet Update program, and it will show you all the updates that are available, checking your system against our system. Download those, install them, and if everything works correctly, you're done. Okay? There really is no third step, so it's basically that 2-step process. But because you're attending the webinar, you are invited to do the update at this point. So, yay, that's another bonus for attending the update. All right, I'm going to very quickly try to answer some questions here, try to get you away as quickly as we can. One customer asked, I currently run 3,000 checks via Zermed for our recurring customers each month. That would be $150 for batch eligibility a month according to your numbers. In addition, we do about 2,000 other verifications, which I assume means commercial, or discounts offered for super high users. Yes, we'll talk about that. Haven't given that any thought. I think what we've got offered, to people is pretty affordable. But if you're doing a lot of checks, then then we'll talk about that. My customer, who's currently probably doing the most of these, is according to their information, they're doing about 30,000 a month. So a lot of this, that I'm talking to you about, I mean, we've already proven that we can handle a pretty good volume. So, is there a time deadline for batch submissions, and are there batch size submissions? Basically, the time deadline is we try to start processing these eligibility checks at midnight. So basically, if you get your batch into us prior to midnight, it's going to be processed that same night. And when I say midnight, we're talking about Central Time. But I'd suggest getting it in, sometime during the day. We're going to process it and have it available to you by the next day. Okay? Is there a batch size submission? Okay? There may be a physical size that we can accommodate, but like I said, our customers are already sending us, the biggest batch we've seen is 2,400 checks that we've processed already. and that takes some significant computer time. Took in that particular example about 8 hours. So it takes a while to do 2,500 checks, but for you, you're sleeping, so you don't care. Lee asks, we prepare our Medicaid orders about 2 to 3 days before shipment. Do I understand correctly that we can't do a forward date for eligibility checking? No, that's not quite true. I didn't mean that you can't put a date on it that's forward. It's just that, for example, Medicaid system, let's say you did the batch check 2 weeks in advance and the patient dies in a week. Well, even though you did the check and it said, great, the patient's good, they died in the meantime, so it really didn't do you a lot of good. But 2 or 3 days, absolutely. I would say, do your date of service as long as the Medicaid will allow that, would be the only thing. Okay? All right.
Hey, Rick, do you want to answer the last question there? How are the pass-through charges billed?
Great question. Basically, all of this billing is going to be done generally monthly, and so we will get a bill from Ivans, which will be itemized per each user, by your customer account number, and so we'll basically send you a bill for the fees through us, and then we'll also add those pass-through charges onto the bill as well. For you to see. If you are doing a electronic, monthly charge with us, we'll just bill that for you. If not, we'll excuse me, send you a bill. So somebody else asked, do I need version 2013 for the new eligibility features? Absolutely. This is a part of the update. This is one of the big features of the update. Okay. All right. Last call for questions. Mike, did I cover everything? All right. I want to take another poll.
I believe you did, yes.
What do you think about batch eligibility? Okay. Hold on a second. I've launched the poll. There it goes. What do you think about patient eligibility in batch? Will you use it? Yes, it'll be a great benefit to my work. No, we prefer to do the eligibility check manually. No, it seems too expensive. Or no, I have another reason. So, give people a moment to answer there. All right, you're going to have to go quickly because we're over time here. So I'm going to close down the poll. I'm going to share that with everybody. Got 50% of the people think that it would be a great thing. 9% still prefer to do it manually. 23% think that's too expensive. That's a little bit surprising at 10 cents a check. If your claim is worth $150, that's a small price to pay for the assurance that your claim's going to get paid. And we have 18% who have another reason. And if you're doing your patient eligibility another way and you're happy with it, that's fine. But this is a great way to do it through Team. The data is saved in the customer, and so there are a lot of advantages to it. As we go through. One more poll here. I'm going to very quickly go. One of the things that we added this time is the little talking head down at the bottom right-hand corner. And so kind of wanted to ask people, did you enjoy the talking head in the webinar? Yes, it helped me stay focused on the material, kind of, like a face-to-face conversation. Yes, it made me laugh. And I'm not sure who put that poll in. No, it was too distracting. Or no, I don't like horror movies. I'm going to have to figure out who created these polls for us. But anyway, go ahead and, oh, I'm sorry.
You need to show the poll, Rick.
Launch the poll.
There we go.
All right. Well, that wasn't nearly as funny then if I didn't have the poll launched. But anyway, did you enjoy the talking head in the webinar? I'll go ahead and say, as you finish the webinar, I think we've covered several, most everybody's questions here. But as you exit the webinar, you'll have a kind of a survey. Did you enjoy it? What did you like about it? What did you not like? Were there any problems? I would really appreciate if you'd take just a minute to answer that. It's very helpful when we're creating new webinars to know what you did and didn't like. I did have one, customer asked, when will the same and similar feature be available? That's a stay tuned. If you've not figured it out, we are doing features of the update, and the same or similar feature is available now, but I need to wait a bit to have a webinar on that. So stay tuned. Maybe next week, if I might let it go a little bit. All right, we're going to close the poll and share that with everybody. Did you enjoy the talking head? Great. 75% of the people said it helped them stay focused on the material. I kind of thought that was probably, kind of like a face-to-face conversation rather than just a faceless voice. I thought it might help people. 15% said it made them laugh. 8% said it was too distracting, and 4% of the people don't like horror movies. Hey, I appreciate everybody for joining us today on the webinar. I hope that you were maybe entertained a little bit, but more than that you learned something from the webinar. I hope that you will sign up for our patient eligibility, whether you're doing the free version, whether you're doing the batch or Medicaid and the commercial. Definitely choose the freebies that we're offering for people to see if that's something you're interested in. We don't have a lot of experience with the Medicaid and the Blue Cross and Blue Shield, the commercial aspects, so we're really interested in your feedback on is that valuable or not. One thing I did not mention is basically if you do an eligibility check from from the Medicaid or commercial and you don't get information back, you chose the wrong payer, you put in the wrong account number, for some reason you don't get information back, that is not charged. So that's important to know. But thank you everyone for attending our webinar, and we will look forward to seeing you hopefully next week. Thank you.